Thank you, Chairpersons. It's just for the fellows to make them understand what we can do in cases of vascular trauma. Now, this is one of our cases. Just to give you a brief, the trauma and the vasculature could be a blunt trauma where it usually leads to a dissection or a thrombus. And these can usually be managed by an anticoagulant. If there is a massive flow-limiting dissection, we can cover it with a stent. But usually, antiplatelet and anticoagulants would help. The other sort of trauma is you have a transection or you have a pseudoaneurysm formation. This is or an AV fistula. These are the three common types of trauma which we deal with by endovascular means. Now, this is one of our patients who had a roadside accident, had a fracture in the neck of femur, and following that, he had a nail implantation and also had a vascular injury leading to a large pseudoaneurysm and a hypertension. So we just went from the contralateral side and passed in fluency stent graft across the injury in the vasculature. And this is the final result which we got by just putting a stent graft in the profunda femoris artery, and the patient's bleeding stopped and the situation improved. The other sort of trauma which is usually very common, especially in many of the countries like India, is either an injury in the chest or a roadside accident or a gunshot injury. Now, this is one of our patients who had a gunshot injury led to a subclavian artery and venous AV fistula, and this was treated successfully by putting in a stent graft. This is what you see. We have a large AV fistula, we put in a stent graft, and this is a result after putting a fluency stent graft. So these sort of patients can be salvaged, need not require major surgeries, and they can be treated very fast. This is another patient who had a trauma in the neck, had a large pseudoaneurysm of the internal carotid artery and the common carotid artery. Again, this patient was too sick to be operated. And then had a fluency stent graft from the common carotid to internal carotid artery, and the patient did very well after the stenting. Many of our patients also come with large history of blunt traumas, and these patients many times develop AV malformations. These are not the congenital AV malformations. We earlier used to use coils, but as Dr. Jindal told, this sort of treatment never works, and the best treatment is to go back and put some glue, onyx or some sort of a glue, and treat these patients. So just to give you an idea for 5-10 minutes what we do in dealing with interventions in dealing with trauma and vascular injuries. Thank you very much.